Hi, I'm Dr. Alex Ye, and today you're going to check out a live surgery that's going to involve the placement of 4 dental implants, one on the top to replace an upper molar, tooth number 1-6, and 3 implants on the bottom to replace teeth number 4-6, 4-5, and the front lower tooth number 4-2. I hope you enjoy it. So we're just gowned up. I'm getting my gloves, my sterile gloves, getting the patient set up. We're freezing this patient, and we're freezing his entire right side, upper and lower, since we're placing upper implant and 3 lower implants. I always wait several minutes before I start. Of course, the timeline is compressed for this video. So we're starting off with the osteotomy on the upper implant, and because the sinus is hanging kind of low, we are going to be conducting a Crestal approach sinus lift. Here we're using the saline to pressurize the sinus and lift the membrane. And here I'm testing I'm just getting him to breathe through his nose slightly to make sure we didn't perforate the membrane, which we did not. And here we're adding the bone graft material to his site, the socket, and we're pushing it through the osteotomy site and into his sinus. So we're condensing the bone through the osteotomy site, through the perforated sinus floor, and underneath the membrane. So the bone is not getting through the membrane because it's not been perforated. And we're just testing the integrity of the membrane again. It's looking good. Just going to suction off any debris, any remaining bone fragments, and then we'll take it a CBCT just to see the graft material and the sinus lift. So we gown up again and put new gloves on. So I found that there was some excess saline, and so I just sucked it out there. So we're placing the first implant now through the osteotomy site that we've already prepared, and the apical portion of the implant will be placed into the sinus where there is already bone, and we've lifted the sinus. I believe we only need like 2 or 3 millimeters of lift, so not a lot of lift is required. And we're torquing the implant in right now to about 35 Newton centimeters to make sure that our implant is bone level or slightly below. So I'm freshening up his freezing on the lower, because now we're going to be doing the lower implants. So we took a CBCT just to check out the upper implant and to make sure that the bone graft material and the sinus lift is okay. So it looks as though the graft had traveled up a little bit more apical than needed, but still a good result. So here I'm just placing the healing abutment. So now we're preparing the osteotomy for the second implant, which is the lower anterior. That is tooth number 4-2. So we're not using a surgical stent, I'm just placing it freehand. Being careful, obviously, not to damage any adjacent teeth and making sure we're parallel to the adjacent teeth, which we are. This is just a directional indicator to help me visualize. So continuing the osteotomy here. And now we're getting ready to place the implant. I believe that's a 15mm implant, 13 or 15. And I'm pretty sure that's a 3.0 or 3.2 diameter implant, as it is a narrow space. Alright, so now we are getting set to place the third and fourth implant in the fourth quadrant, which is the bottom right side. Let's start with the pilot drill as usual. So after we get the pilot drill lined up there, I always try to be parallel to the adjacent teeth or tooth. And we're switching to the second drill. That's the second drill, which is each successive drill is increased in diameter by a few millimeters, and that's as to not overheat the bone and just incrementally remove bone during the osteotomy. Right now I'm placing the directional indicators for both implants in the back there, so you can see they're quite parallel. So they're parallel to the tooth and parallel to each other. I don't normally use surgical stents for single or implants or two or three implants that are kind of in a row. However, surgical stents are useful for, especially for edentulous cases that you want to do quickly and you want to get implants parallel without having any point of reference in terms of teeth. So we're continuing the osteotomy. You'll notice I'm using Nobel twist drills, but the implants I'm placing are Hyosin, so I'll finish with the final Hyosin drill. This is a Hyosin implant, so we'll torque it in initially with the handpiece, and then I'll always finish it with the torque wrench by hand, and then that allows me to really feel the implant and how tight it is in the bone, and then I can confirm the torque with the torque wrench, which will torque to typically 30-35 Newton centimeters. The fourth implant won't take as long because we've already prepared the initial pilot hole drills and or osteotomy, I should say, and we've already confirmed with the CT that it is parallel. So all I'm doing now is just finishing the osteotomy with the increasing diameter drills. So now we're going to be placing the fourth implant. As you can see, we're using the handpiece to torque the fourth implant in. And I'm hand tightening it with the torque wrench after the initial placement with the handpiece. So we'll do this until we achieve 35 Newton centimeters. So I'll just double check the torque on the implant, make sure everything's good, which it is. Then I'll just clean out the implant site with saline before I place the healing abutments, which is happening right now. So these healing abutments are about 3 millimeters in height. And we'll take a pan. As you can see, pretty good placement, bone level implants with healing abutments. Checking the CT to make sure we're in bone.
So I hope you enjoyed that video. If you liked the video, or if you have any interest in general dentistry or implant dentistry, please like or share our video with your friends. And if you have any questions, please visit us at smilesdentalgroup.com. Remember, all of our implant consultations are free, so give us a call and we'll see you soon.